Oh, there we go. Although we lost the screen, Alexis, it looks like. There we go. Perfect. Okay. Now we're both ready to go and we have a presentation. So thanks everyone for attending this session about a kidney transplant and finding a living donor. I'm Dr. Mike Bevilacqua, and I have a whole team here that we're going to introduce in a second and for this great session today. Sorry, you have to bear with me a second. I've just had a cold. I lost my voice here, but thankfully you'll be hearing mostly from everyone else and not from me, so we won't have to deal with that. So if we go to the next slide, please, Alexis. So for those of you who have been to many of our webinars, thank you for returning once again. If this is your first time, welcome, and we hope to see you for more of them. Just as a heads up, this is where you'll find all of these. So all of our past events are hosted on our BC Renal website. If you click on the bar there that says recorded sessions, you'll be able to see the previous ones. And then for the upcoming sessions, as we do have these on about every couple of month basis, if you click that little subscribe now button on the bottom, you'll get an automatic update when these sessions are coming, so you can make sure to register and attend them. Great, so if we go to the next slide. And before we get started, it's always good to acknowledge, where we all are in the province. Even though we're meeting virtually, each of us are coming from different parts of the province and maybe even elsewhere. Myself over here in Surrey, I acknowledge that I'm coming from the unceded territory of the Katzie, Semiahmoo, Kwantlen, and some other Coast Salish peoples. And I'd invite everyone to reflect and learn a little bit more about the lands that they are coming to this webinar from. So a few housekeeping items. These were displayed on the screen before we get started, but just so that everyone's aware as a little reminder. So we have this format where we do want to encourage some questions, but for privacy reasons, we've made it so that you're muted and we can't see you. And that's very, very specific for privacy reasons. So even though you hear us, we won't be able to see you, even if you wanted to unmute. But that said, we do want to encourage some questions. So if you have a question that you'd like to get in, the way that we'll do that is there's a little Q&A box in your Zoom. And if you type the questions in there, we'll make sure to get to them. Very specifically, use the Q&A, not the chat. The Q&A is the one with the two little speech bubbles. And if you put your questions in there, whenever there's kind of a time for it, what we'll do is I'll collect those questions and I'll bring them to the presenters. Now, one thing that I'll mention is for those questions, we'll try to keep it a bit general. And what I mean by that is we're not going to specifically answer questions about your own unique medical situation. Those are best brought to your own team, but I'll try to rephrase them into a way that's kind of general for the audience. As a last housekeeping item, when you registered, you would have seen there was a button to click that says it was okay to let your team know if they attended. If you did that, we will do that after this session, mainly so that they'll know to follow up to see if you have any questions. After this, you'll get a little link to invite for some feedback so that we can improve these sessions on an ongoing basis. And then again, if you want to look back, you'll see that this recording will be online. Okay, but to today's session, really, we're going to be talking in a lot of detail about the whole transplant and finding a donor process. You would have, if you've come to our previous webinars, you'll see that we touched on this briefly in our webinar about modality selection. But here now we're going to spend the whole time talking about this. And our goal with this session is to provide some background information to leave you better equipped when you're talking about this with your own kidney team. Very specifically, this in no way is meant to replace those conversations that you will have with your kidney team, because that's really where you'll get to the nuts and bolts of your individual situation. But our goal is that you go in better informed and with some questions ready to ask with your team there. Great. So if we go to the next slide, this really, I think we'll address this through the content of the presentation. So maybe just for the sake of time, we might go past this, but it's to say that to introduce this topic, when we have many different options available, for those whom transplant is an option, it generally is the preferred choice. It does take a lot more planning, which we'll hear about in a second. So a lot of work goes into planning ahead and making sure that we're ready to go. So if you're at a point even where you haven't started this process, I'm glad you're here to be hearing about it now, because the more time, the better. but otherwise we'll cover this in more. So I think we'll just go to the next slide. So with that, that kind of sets the stage, but I really want to introduce and thank the team that we have presenting here. We have a great team from St. Paul's who work on both sides of the house. And what I mean by that is both the recipient and the donor side of the transplant process. And we're going to hear from each of them in turn. And then I'm very, very happy and very thankful that we have two individuals here, Frank and Kelly, who have lived experience with this process. Frank, who's received a kidney, and Kelly, who's donated a kidney, and they very kindly have offered to share their personal stories with us. So I'm really, really looking forward, and I thank all of you for doing the session. And so with that, I'll turn it first over to Jody, who's a social worker who I've worked with in the past and is excellent over at St. Paul's. And I'm looking forward to hearing from you. Thanks, Jody.
Thanks so much, Mike. I've had the pleasure of working with everybody who's on this webinar today, and it's my pleasure to be here. So just an overview, we've got our presentation divided into two parts today. So we're going to start out talking about the recipient program. So Zamina, who's one of our recipient nurses extraordinaire, is going to be going through in detail in a few minutes about what's involved there. And then for part two, we'll be looking at the donor side of things. And Erin, who's our donor nurse extraordinaire, is going to be talking about that side of things as well. Next slide, please. So Zamina will be going through this, and this is a little picture of one of the pamphlets that's available through BC Transplant. You'll hear more about different resources as we go forward, but Zamina is going to be reviewing who's eligible for transplant, what the options are, what the process looks like, and then we have the pleasure of hearing directly from Frank, who has gone through this himself, and then there'll be an opportunity for questions for the team and for Frank. Next slide, please.
Sorry, just a bit frozen here. Stay with me.
That's okay. We can't have a Zoom webinar without something going wrong. Okay, excellent. So we wanted to start off and just show some of the recent statistics. So if you look at this bar graph, the light blue, so the smallest numbers on the left side of each of the columns is the number of living donor transplants that were done. And the middle number is the number of deceased donor transplants. And then the darkest blue and the tallest column is for all of the combined transplants in any given year. So obviously during the pandemic, we did have a drop in the number of live donor transplants for various obvious reasons. And as you can see as well, that number is the lowest across the board over the last several years. We have slowly been overall doing more transplants, which is great. But we want to continue to promote live donor transplant, and we are about to hear more about why. So next slide, please, and I will hand this over to Zamina.
Hello, everyone. Thank you for joining today. As mentioned before, my name is Zamina. I'm one of the nurses at St. Paul's Hospital that helps navigate recipients through this process. So in general, I wanted to just talk about who is eligible. So potential recipients are those with chronic kidney disease, and there are a couple options. There's living donation and deceased donation, which I'll go over in detail some more in later slides. Generally speaking, kidney transplant is considered a treatment, and you might be wondering if it's the right one for you. So like every procedure, there are benefits and there are also risks. This slide does provide some general benefits and risks, as you can see. One of the benefits is just having more energy, freedom from dialysis, ability to travel and have greater independence in your life. And there is also increased life expectancy as well as ability to resume regular diet. So there are some risks associated with the procedure itself. There's things like bleeding and infections. You will be on immunosuppression for the lifetime of the kidney, and so that can make you at more risk for infections and other types of cancers. All of these specific benefits and risks will be reviewed with you at the time of your appointment with our team. Next slide, please. So really the first step is that your primary nephrologist will refer you to one of our transplant centers. And what that roughly is, usually when your GFR is about 20 to 25. At the time of your referral, your primary nephrologist will continue to resume all of your regular renal care, including your monitoring your regular blood work, medications, potential discussions of renal replacement. When your referral is sent to our team, it does not mean that you're automatically on the wait list. What it means is that your file has been sent to us for review, and then we book an appointment to see you with our team. Next slide, please. So when you come to see us, you would have completed what we call baseline testing. This is testing that's requested from all of our potential recipients, and it does include some blood work and some chest X-ray and ECG. And then there's also some more details on the slide about the baseline testing that we request at the time of your referral. Next slide, please. When you come to see our team, you'll be booked for an appointment with a transplant physician. It's a similar nephrologist to your home nephrologist, except it is a physician that specializes in transplant as well. You'll also potentially meet a transplant surgeon, a social worker, a nurse, and any additional staff, depending on your situation. When you come for an appointment, the first thing, prior to determining when your appointment occurs, there's a few factors that are considered. So if there's a potential live donor, we would look to seeing you sooner. And I'll talk about the live donor process versus deceased donor in later slides. We also determine your appointment by your blood type and your anticipated wait time to transplant. The idea is that we want to see you close as possible to when you see the transplant so that you don't have to repeat your testing multiple times. Next slide, please. So after you meet with our team, our doctors will review with you any additional testing that might be required specifically for your situation. The approval process will depend on your medical history, any additional tests that are required, and what the availability are of those appointments. At the time of approval, your time to transplant can also depend on your blood group and your dialysis start date, and if you have potential donors as well. Next slide, please. So at the time of approval, the question is, what are the options? The two options that we have is living donation and deceased donation. If you are what we consider pre-dialysis and you have an approved donor, we would look at organizing a transplant closer to when your GFR is 15. The idea is that we want your new transplant to last as long as possible. And so we try to time it in a way to maximize the time that you can keep your kidney. If you're already on dialysis, then the options are that you can receive a transplant from the living donor process if you have an approved donor. And if you do not have an approved donor, then you can be considered for the deceased donor waitlist. Next slide, please. So you'll hear us talk about living donation quite a bit, and I'll let Erin kind of speak to the donor process a little bit later. But what are the benefits for the recipient? So we find that kidneys that transplants that are done through the living donor process, they tend to last longer. It's a way to bypass the wait list, because at this point, if you have a living donor and you're approved, then you can proceed with an OR. There's also potential to receive a transplant, what we consider preemptive. So that is receiving a transplant before starting dialysis. Living donation also creates an opportunity to plan ahead. Depending where you live in the province, you may need to set up accommodations close to Vancouver. After transplant, we do ask that you plan ahead to expect to be in Vancouver for about 3 months. We have lots of time to plan for this, and at your appointment with us, you will have a chance to meet with the social worker to discuss reimbursement and options available for you. Living donation also promotes greater control over your personal life and professional life. Next slide, please. So I've mentioned the deceased donor waitlist a couple times. So how that works again is at the time of approval, you would be what we consider activate to the waitlist. How you're ranked on that list is based on your blood group and your dialysis start date. You can see some of the estimated wait times based on blood group and dialysis start date here. And there are other factors that can contribute to your unique situation, and we'll talk about that in the next slide, but it's called your level of sensitization. Once you're active on the wait list, once you're active on the wait list, if there's any changes to your health, it's important to communicate that with our team, because we will put you on a temporary hold for medical issues or for travel. The idea is that we want you to receive a transplant when you're in the healthiest, strongest shape. So sensitization, this can also affect your wait time to transplant. The idea is that we want to find a safe match for you. So sensitization is what can occur when you have events such as a blood transfusion, pregnancy, transplant, or any serious infections where you're on antibiotics. The idea is that your body produces antibodies, which is a natural response to these sorts of events, but it can affect your wait time because these antibodies may want to potentially fight with any donor options. So we want to make sure that it's a safe match for you, that your body won't reject it. Next slide, please. So what's your role as a recipient and your responsibility in this process? So continuing to attend your regular scheduled appointments with your team, managing your lifestyle factors, such as maintaining a healthy, active lifestyle, healthy weight, diabetes control. These are, good for your general health, but also very important for transplant as well. Once you're referred to our center, it's important to keep us in the loop if you have any new medical concerns or if you're seeing any new specialists, particularly if you're admitted to the hospital. Like I mentioned, there is a potential that we would put you on a temporary medical hold until you've recovered and you're in a strong state to receive a new transplant. Please also keep us in the loop if you have any change in your contact information, as this is the primary way we will call you via phone. Next slide, please. The transplant itself is a surgery that takes about 3 hours. As you can see in this picture, the original kidneys are left typically in place. If there's a plan for a kidney to be removed, our surgeons will review that with you at the time of your appointment and basically talk about more surgical anatomy planning at that time. Otherwise, the transplanted kidney is typically placed in the lower abdomen, as you can see here in this image. Next slide, please. Once you're admitted to the hospital, you can expect to be in the hospital itself for about 5 to 7 days. At the time of your hospital admission, you will be assessed frequently and you will receive anti-rejection medications immediately. Please plan to stay in Vancouver for up to 3 months post-transplant. This is a really critical time that our team wants to make sure that your body is safely receiving the transplant. We will do regular checkups and you'll meet with the post-transplant team in person in Vancouver for that time frame. Once you're stable, there is a plan to transfer you back to a post-transplant clinic closest to home. And the social work team locally and at St. Paul's work very closely with you to make sure that you are well supported throughout your journey here. Next slide, please. some people ask about rejection and failure. So acute rejection is when your natural body wants to attack this new kidney. It's because it identifies it as a foreign object. This occurs in about 10 to 15% of patients in the first year, which is one of the reasons we like to keep a close eye, and we ask for you to stay in Vancouver for those 3 months. This type of rejection does respond well to treatment, and it does not mean that you will lose your kidney. Chronic rejection is more of a slow, delayed, progressive decrease in graft function. The reasons are less understood, and if this is identified, then our doctors will review with you specific to your case and what the options are available. But in general, it's nice to know that an average lifespan of a kidney is about 16 years. So that's the end of my portion, but I'm very honored to introduce a transplant recipient, Frank.
Good afternoon, everybody, and welcome to this. It's great to see so many people. As Zamina mentioned, I am a transplant recipient, receiving my kidney in 2017 from a living donor. My youngest sister, Sandy, was my donor. So for me, it was a family event. There's two parts that I kind of want to relay to you. One is sort of the journey itself, because in my particular case, I had some very, very, I'm not going to say lucky, but some good outcomes. But there was a number of hurdles on the way too, and I think it's important to sort of let you know what the journey was, and then I'll spend a minute or two on my efforts to look for a living donor. And just because my sister ended up being that living donor doesn't mean it was easy or automatic. My journey began probably about 20 years ago with, I had an endocrinologist who was very, very, probably, one of the best doctors, and I've had a lot, believe me. He started, about 20 years ago, started plotting on a graph my GFR numbers and my creatinine levels. And I didn't really know at the time why he was doing that. And eventually he said, well, the way these numbers are plotting, you're going to need a transplant at some point down the road. And I thought, okay, well, and then he added in somewhere 12 to 15 years. So what do we do when we hear 12 to 15 years? We say, well, that's an eternity. So like probably most people, I forgot all about it. Then all of a sudden, a number of years ago, the 12 or 15 years was up. So I started the process of the transplant process. Once I was approved, or once I was put to the transplant team, I spent a number of years at the kidney care clinic, and I am a patient at St. Paul's Hospital, so I was fortunate, and I also live in Vancouver, about 20 minutes from the hospital, walking. So those are a couple of things that were certainly that were in my favor. So I went. Lost my train of thought. So once I was taken care of, by the kidney care clinic at St. Paul's, and I was there for a number of years. took a job offer in Toronto for 2 years. Went to Toronto, was taken care of by a kidney care clinic there. And they were actually the first ones to start talking about transplant. And they're very much, as we are here in BC, they're very much strong proponents of the preemptive transplant. So preemptive means before I needed to go on dialysis, because dialysis for me was something that everybody tried to avoid as best they could. I've been a type 1 diabetic for 55 years, 56 years. I've had 2 heart attacks. And so my heart's not good. I have type 1 diabetes. So going on dialysis, which is difficult on a healthy body, would be, in everybody's estimation, worse for me. So they got me talking about looking for donors and stuff like that. And I'll go into more detail in a minute or so. What happened was, I thought to myself, look, if I find a donor here in Toronto, there's going to be problems because I'm going to want my surgery in Vancouver. My donor will be in Toronto. And I didn't see that, while it can be done, I didn't see that as, at the time, as an option. So I thought, well, I'm going to go home and talk to friends, family, so on and so forth. So after my search for a donor, my younger sister agreed to do it. And then we started the process of assessment. I believe it took about a year for both of us. And they checked everything. I had more tests, more vaccinations to update my vaccine levels. I think one day I went to get vaxxed. I got 5 shots in one arm and 6 in the other. But what it was doing was preparing me for the ultimate, the transplant itself. So lucky for both of us, and fortunate, we are siblings. So our blood type and blood makeup was very, very compatible. And my cardiologist was on board. And so there was a tremendous amount of back and forth between the cardiologist, the transplant nephrologist, who were excellent, all of them, and myself, of course, and my sister. And I did have a transplant nurse. My sister, obviously, a donor nurse, and I like that idea because it keeps a separation of responsibility and a separation of accountability. Because if both of us had the same nurse, you run the risk, I think, of maybe being trying to coerce, or that maybe leaning one side to the other. Whereas if each person has their own individual nurse, then it's much more private. And of course, my sister and I talked just about every time we met with the nurse, so it wasn't kept a secret. But we were finally approved. Surgery date was set for March of 2016, March 30th. I remember it very clearly. So the week leading up to March 30th is a Monday. March 30th is Monday. The week leading up to it, having had heart problems for a very large portion of my life, I started to feel angina, chest pains. Sometimes it was brought on by just walking, sometimes it just came on. So I kind of thought, well, it might be stress, it might be, anxiety, these types of things. But it did bother me, to be honest, because if I'm having chest pain because there's blockages or something else going on in my heart that I can't tell, I needed to make sure that I was still okay. So as is pre-planned, the Friday before the Monday surgery, you attend the hospital with the transplant nurse or recipient nurse. And so I mentioned it to her that I had these chest pains. So she immediately went to the transplant nephrologist. And I use the word immediate. It seemed immediate. It might not have been as quick as that, but I was told that the transplant nephrologist was on the phone with my cardiologist. What are we going to do about these chest pains? So anyways, I think they were on the phone for close to an hour because there was a lot of, obviously, this is a big decision. So the two of them decided, and Dr. Jag Gill, who was my transplant nephrologist at the time, and still is actually, advised me that they were going to postpone the transplant. And they wanted to do an angiogram to see what was actually going on in my heart. So here my sister and I had spent a year or more with numerous tests, numerous pokes and prodding. My sister had a biopsy done on her kidney to make sure, that everything was clear, and we're all set to go. And now 3 days before the transplant, it's a stop sign. But for me, I thought, you know what? In a way, I'm a little bit relieved because I need to know what's going on in my heart. My sister had a little different view. It had taken her a whole year to get up the nerve and that kind of stuff to do it. So for her, I think it was a little bit tougher. So within 4 days, I had the angiogram, and lo and behold, there was blockages, and I was referred to a heart surgeon because I needed a triple bypass surgery before anybody was going to do a transplant. So how long was this going to take was my main concern, because I knew my heart already wasn't very good. And to me, the longer we postpone the transplant, the tougher it is for my heart to take it. So that would have been in June, I believe, that or March, sorry, that the angiogram was done. The decision was made to do the triple bypass. It occurred on October 19th of 2016. So the recovery from that was extremely difficult. I was holding so much water that I think I was about 25, 30 pounds heavier just from water retained from the heart surgery. So I went back to the kidney care clinic and also the pre-transplant clinic, and we tried all sorts of things to get rid of the water, and it wouldn't go anywhere. So guess what? All this work to try and do a preemptive transplant down the drain because now I need to go on dialysis. So I wasn't real happy, and it was actually quite a blow to my, to me personally, because things were going very well. Anyways, I was on dialysis, and I have to admit, I didn't like dialysis very much at all. It probably brought out the worst in me from a mood perspective. But the water did leave, and obviously I was kept, functioning. And so the transplant finally was, my sister had to go through a few more tests, and I had to have a few more tests done, but everything was fine. So the transplant was then scheduled for September 25th, 2017. So in early 16 was the first go around, postponed the heart surgery in October of 16. And less than a year later, I had my kidney transplant successfully completed. And here I am today, 5 years later, doing very well. And my sister also doing very well. So everything turned out great. The surgery itself, you go through the regular routine of coming out of it and getting your bearings, and your loved ones come to see you. And the surgery was on Monday, and by Friday I was discharged. So I thought that was a little quick, because I wasn't so sure I wanted to go home just yet. But the two nephrologists looking after me on that day said, well, first of all, you're doing well. Second of all, a hospital is probably the last place you want to be, because you're much more susceptible to infections and so on and so forth. So I went home, and life's been good since then. So it was quite the roller coaster of a journey. And I was going to mention some of the things when I had to start looking for a donor, because again, the objective was to do a preemptive transplant. So a couple of things that I learned. First of all, it's not easy. And it can be stressful, but when I started the search, remember that was in Toronto, I still had a fair bit of time, in my opinion. I was in Toronto in 2012 and 13. I had the transplant in 17. So I still had some time. So if I could not find a donor in Toronto, then what I finally decided was to come back to Vancouver, where friends, family, acquaintances, colleagues, and all that kind of stuff were around. So one of the things that I found myself doing was self-eliminating possible donors. And by that I mean I look at a person who's a very good friend, and even more so in the case of my family, my sister. And I start thinking, well, I don't want to put them through this. And I don't want them to feel obligated because I'm a friend or I'm a brother or whatever. So you start to think of reasons why you don't want to ask. And if I can leave some advice, please ask them, because it's not for you to decide what the donor feels about giving you a kidney. That's their decision and their family's decision. So that's one thing I learned. The other thing is I found myself, well, I know that person has a condition, has diabetes or lupus or something like that. So then I started self-eliminating them, because I thought, well, no way can they give me a kidney. They're sick. And again, what I learned was that it's probably best that a doctor make that decision. So ask them anyways. And if they decide to go to the next step, their doctor will let them know whether it's a good idea or bad idea, or whether you're just automatically disqualified. The other thing I tried to do was approach my peers and my colleagues. And that didn't work out as I expected. I thought everybody liked me. And so anytime I was in a situation, say a conference or a dinner or anything like that, when the time was right, I would sort of pop up with, geez, yeah, I went to the doctor today and they're talking about a kidney transplant that I might need. With the full expectation that everybody all of a sudden jumping up and down, yelling, pick me, pick me. And of course, that didn't happen. And as a matter of fact, a few minutes later, I was standing or sitting there by myself, and I thought, well, where'd all these people go that, I thought were with me? But my advice there is just never give up. Never give up, because you just never know when somebody will step up. And that's what you want, is for them to step up and help you. And the way my sister ended up saying yes is we were at Christmas dinner at my other sister's. My mother had already passed away, so our family was there. My brother too had already passed away, a younger brother. And it was our first Christmas since I moved back from Toronto. And so after Christmas, after dinner, we're sitting around, and I casually said, yeah, when I was in Toronto, I think I found out that I might need a kidney transplant. So my dad, bless his soul, says, well, what does that entail? So that was my opening. And not that I knew everything, believe me, because I knew the very basics by then. I just started talking, and they're quietly sitting in the corner, Sandy, my youngest sister, and she says, well, I might look at that. So I didn't expect it, but there it was. The hospital is excellent at providing a huge binder. So I gave her the binder, left her alone. It took a few months. She had to talk to her family, et cetera, et cetera. And eventually she signed, or she sent in on her own, without me, of course, but on her own, sent in a notice of intent, or an expression of intent. And that got the ball rolling, and then the medical questionnaire and so on and so forth, to end up where we ended up eventually on September 25th, 2017. And that, in a nutshell, is about 5 years worth of work.
Fantastic. Thanks, Frank. Thanks so much for sharing that very personal journey, and it covered every step along the way. So I think that's just fantastic. Okay, so we also, for our team, we have a few questions that have been coming through in the chat. So I'll ask everyone to come back, because we'll ask a couple questions here. The one that's come up a lot is, there was a mention a couple of times about that 16-year time frame for a kidney to last. Is that the same for a deceased donor transplant as it is for a living donor transplant? They were just asking about a little clarification there.
So in general, living transplants tend to last longer, but it's going to be very specific. And as far as, the donor and the recipient combination and how well they're matched, and there's lots of different factors, but in general, living donation transplants do last longer, and that's why we talk about that early in the game.
Exactly. And I always tell people to remember, anytime we're talking about times, if we're saying it's a 16-year average, that's based on transplants we did 16 years ago, right? And it's an always evolving field there, but that's exactly correct, Zamina. Okay, there's actually a very good question I haven't heard before. So if somebody's approved for a transplant, but then it takes longer than they expected for their kidneys to actually decline to where they need it, is there some kind of time frame that they would have to be reassessed? As in, does it expire and it's only good for a certain time, or what happens in that situation?
That's an excellent question. So this is actually one of the reasons why we tend to see people when their GFR is closer to 20, so that, the workup makes sense. So we're not repeating testing. But after someone is approved, we like to repeat the baseline testing every 1 to 2 years in general. And that just makes sure that, that your file's up to date, that there's no new issues. And, depending on your situation, you might be booked for a review appointment. So, and it's important to note that at any point in the transplant process, whether someone's approved, if they're pending a living transplant, or they're activated to the wait list, additional testing can be requested at any time. And at every point, we're just making sure that it's safe to move forward. So there's no hard expiry date, but we do like to touch base regularly, and additional testing might be requested.
Yeah, perfect. Exactly. Okay, and then just there was a couple of clarification. There were some numbers displayed about average wait times for blood group. Is just to clarify, was that the current wait times? It was displayed on slide 20.
Yes, I'm just looking at it too on my hard copy, but yeah, that's the most current wait times we have. And of course, as mentioned, there can be variations to the wait time based on your individual situation, which will be discussed at the time of your appointment. But those are the most up-to-date numbers we have at this time.
Yeah, that's what it looked like to me too. There were some questions, and maybe I'll just take this one about, did that change during COVID in terms of wait times? And actually, I'll just say there's things that change that in both directions throughout this last 2 years, meaning both increasing and decreasing. This is also, updated regularly. So it's not, but it doesn't change that much month to month or anything like that. Those approximations are very good. And the last one that maybe I'll take as well is, there was a question about stem cell therapy and things like this. This is not exactly something that's in routine or kind of approved clinical use. So, thanks for the question, but kind of not ready for prime time just yet. Okay, so to all of you, if more questions come through, by all means, get them in. Even if there's more questions from the recipient side, we'll take those at the end. But in the meantime, I think just in the interest of time, we'll shift gears a little bit. And now we'll talk about the donation side. So we heard a little bit about the whole recipient side. Now let's shift gears a little bit and hear about the other side of things.
Great. Thank you, Mike. And thanks again, Frank, for sharing so much about your experience. That was fantastic and very helpful information. So as we've just said, we're now going to switch in here what things look like from the donor side of things. So we're going to be hearing from Erin about what is involved when somebody wants to donate. What does the assessment look like? You'll be hearing from me after that about the roles of social workers on both sides of things. And we're going to have an opportunity to hear from Kelly, who's a donor herself. So that'll be great as well. And then we'll have questions and answers afterwards, like we just did. So thanks so much. And over to you, Erin.
Hi, everyone. My name's Erin. I'm one of the nurses with the Living Kidney Donor Program here at St. Paul's. And I'll be sharing some information about our program and the general donor workup process. So throughout your workup as a potential living kidney donor, our role is in providing education and assistance with arranging your testing. Our main priority is your health and your safety, supporting your decisions with how you would like to proceed, or perhaps not proceed with your workup, and maintaining your confidentiality. Next slide. We base our program on several principles. So when you come forward as a potential donor, you should do so voluntarily and without coercion. Throughout the process, you'll have the freedom to set the pace of your assessment that you're comfortable with. And because of this, we really encourage and rely on you to remain in contact with us in order to keep the process moving along. Informed consent is ongoing throughout your workup, and it's always your choice to proceed or to withdraw from testing at any time. Next slide. So who can be a kidney donor? Often it's family members, friends, acquaintances, and work colleagues that will come forward. If you come forward, but you're not compatible to donate directly to your intended recipient, you're still able to help that person to get a transplant by participating in the kidney paired donation program, which I'll talk about a little bit later in the presentation. Next slide. So unfortunately, not everyone that comes forward is suitable for kidney donation. And there's a number of reasons why it might not be safe for you to be a kidney donor. And for those reasons, we might decline you from proceeding. So this might include age. So you need to be at least 19 years old to donate to a friend or a family member. And this age is actually increased to 25 years old if you're wanting to donate anonymously to any person in need. Older age can also be a factor, but we don't have a specific age cutoff. It just depends on the stability of your overall health. As well, you might be declined if your kidney function is too low, if you have diabetes or impaired glucose tolerance, are obese, have active substance misuse, cancer, uncontrolled blood pressure, complex anatomy, or there are psychosocial issues where you may have been coerced or where you're not able to give informed consent. So as Frank mentioned earlier, if you ever have a question of whether or not you might be eligible, just reach out to us. That's what this process is for. We'll assess you and let you know if you're suitable to move forwards. Next slide, please. So here's a quick snapshot of the donor assessment process. It starts with you calling or emailing us to register. We then send you an information package. And should you choose to proceed, you would send us back the completed registration information and health questionnaire. We would then call you to review your health questionnaire and provide education about the general workup process. If suitable, we would then ask you to complete some baseline testing, which includes some lab work and imaging tests. This can be arranged close to home and in collaboration with your family doctor or local clinic. Next, we would arrange your compatibility testing with your recipient and organize a time for you to come to St. Paul's to meet our nephrologist, our social worker, and a nurse, as well as to complete a couple more tests while you're here. Once this is done, the team would review everything to make a final suitability decision. If the risks were too great, you might be declined. Otherwise, if it's safe to proceed, we could start to discuss some potential surgery planning or entry into the paired exchange program. Timing of an actual surgery is dependent on the suitability of your recipient, your preferences, and the OR and surgical team availability. An assessment with the surgeon is usually organized at a later date if you decide to proceed with donation surgery. Next slide. So here's some stats of the volume of donors that we see at any given stage throughout the workup. So as you can see in dark blue, this is the very beginning of when people first register. That number is the highest. In light blue, that's the number of people that actually go on to donate. And as you can see, that number is much smaller. So for this reason, we encourage recipients to do as much donor outreach as they're comfortable with. And we don't limit the number of donors that can be in workup at any given time. So apologies that these stats are from 2018 and earlier, but the numbers over the past couple of years haven't really been a true reflection just due to the pandemic. Next slide. Okay, so I briefly mentioned the kidney paired donation program before, often referred to as the KPD program for short. And I'll go into a little bit more detail about it here. So if you get approved to be a living kidney donor, but you're not compatible or you're not a suitable match for direct donation with your intended recipient, you might choose to donate through the kidney paired donation program. This is a Canada-wide program run by the Canadian Blood Services, and it works by matching you and your recipient with other incompatible pairs. You would never donate without your intended recipient getting a transplant in return. This program is also suitable for anonymous donors who are not linked to any recipient and who just want to donate to any person in need. Next slide. So some facts about this program are that entering does not guarantee a match. It is very much dependent on who else is in the program and whether or not a match is available. This is an anonymous program, so if a match were to be received, the identity of everyone involved would remain protected. Sometimes you as the donor may be asked to travel, but most often we are working with local transplant centers or centers that can accommodate shipped kidneys. Again, this would always be discussed with you to see what you're comfortable with. Next slide. So we do have the capacity to work with out-of-country donors, just as we do with out-of-province donors as well. Now, for out-of-country donors, there's a couple of unique things that you should be aware of. So if you live outside of Canada, you must be known to the recipient, you must be blood type compatible, and you must have access to healthcare in order to complete your workup and to have appropriate follow-up should you go on to donate. The preliminary workup is all done in your home country, but you would then need to travel to Canada to finish your workup. Your testing is repeated once you're here, and it is covered by MSP. Depending where you're coming from, you might need a visa to travel here, and it is possible that that visa may not be granted. Unfortunately, we have no control over this. As well, it's possible that you might travel all the way here to Vancouver to complete your assessments, and you might still be found unsuitable to proceed with donation. Next slide. For the surgery itself, there's two types. The first is laparoscopic, which you can see on the right side of the diagram. This is minimally invasive surgery. And the second is an open nephrectomy, which you can see on the left. So laparoscopic is the most common, and it is the preferred type of incision, as it has a lower chance of an adverse outcome. It decreases post-op pain, it shortens the recovery time, and it improves cosmetic outcomes. Next slide. So living donation is major surgery, and although complication rates are low, no surgery comes without some risks. The length of the hospital stay is usually 3 to 4 days, and the most common concerns usually relate to incision pain, nausea, and constipation. The risk of a serious complication is about 1 to 2%, and the risk of dying as a result of the operation is 0.03%. Next slide. If you donate, know that long-term, your life expectancy is not reduced, that your kidney function will be about 70% of your pre-donation function, and that your risk of kidney failure later in life is very low at less than 1%. For those that want to get pregnant after donating a kidney, we recommend waiting at least 6 months before becoming pregnant, and we recommend regular check-ins with your doctor to monitor both your blood pressure and your kidney function. For all donors, there is a long-term risk of developing higher blood pressure and protein in your urine. Next slide. It's for this reason that we do lifelong follow-up to monitor your health. So we do ask you to complete annual medical exams with your family doctor to monitor your blood pressure. And we also ask you to do some lab work at that same time. All the results are copied to us so that we can review them. And if needed, we can arrange a consult with our team for additional support to address any concerns. Next slide.
Great, thanks, Erin. So hi again, everybody. So now I'm going to talk about the social work roles and what's involved in that. So next slide, please. So for the recipient side of things, there's a number of social workers that you're going to be connecting with. So for those of you already involved in with KCC and or dialysis, you'll have a home social worker. And you may or may not already know them. It depends if you've had contact with them. Basically, they can provide you with ongoing support before the transplant. They can assist you with donor outreach. We will talk a bit more about that. And of course, we already heard a little bit from Frank about that. And they work with you and with our team here to help plan for transplant if that is where things head. So as part of the assessment process, which you heard about already, you would see a transplant social worker when you come for your clinic appointments. And so the transplant social worker does an assessment to make sure that you have the support that you need and potentially resources that you need to be able to get through having a transplant. As you've heard, for those folks who live out of town, so who don't live in the Lower Mainland, it does involve making a plan to stay in the Vancouver area for the 3-month follow-up. So that can involve quite a bit of planning, and it can be pretty stressful for people who live out of town because they aren't going to be in their own home. They're not going to have the usual supports around them. So we've got to make sure that you'd have supports who come with you here. So the transplant social worker also provides counseling and emotional support and can give you information about donor outreach support and strategies. And I'll talk more about that in a sec. And then while you're here, when you do have your transplant, the post-transplant social work team will support you through your recovery while you're here in Vancouver and provide whatever support you need as long as you're here in Vancouver. And then once you head back home and are transferred to your home team, then that social worker would take over supporting you at that point. Next slide, please. All right, so let's talk about donor outreach. So as you heard from Frank, and you may already know, donor outreach can be a pretty stressful thing. We've already heard about the benefits of live donor transplant. And we heard from Frank about how hard it is to talk about living donation. You know, that was a great story you told Frank about being in a room with folks that you knew liked you, and as soon as you said something, they all scattered. So one of the things we really encourage people to do to make this process easier is to find what we call a donor champion. So this is somebody close to you that you trust who would basically do this piece of work for you so that you as a recipient don't necessarily need to do it all yourself. It can be really helpful. It can be a family member or a close friend who can do social media posts, who can send an email blast, and who can be having those conversations for you so that you're not the one who wonders why everybody's run away when you've said something. It can be very uncomfortable and awkward to talk about. And both the transplant social worker here and your home team social worker can help you with some resources. We have sample letters that are very clear and brief that you could use or that your donor champion could use to get the word out that you need a transplant. And it's really important to have good support throughout this process. Next slide, please. So the information for recipients, as I mentioned, you know, there are resources available. This little pamphlet here from BC Transplant has some good outlines. The BC Transplant website also has the sample letters. And as we heard really clearly from Frank, you know, you need to leave it up to people to make that decision about whether they want to donate or not. As you also heard, you know, not everybody's going to be comfortable with donation. It's a very personal decision. And like we've also heard, there's a separation of teams to keep that decision as clear as possible. So I work on the donor side of things. So that means I assess donors and I don't work with those recipients so that I can be provide a safe, you know, clean environment where the donor or potential donor can talk about whatever concerns they have and make the decision that's right for them. So because we saw that there's many more numbers of people who start the donation process than actually end up going ahead and donating, that's why it's a really good idea to just keep getting the word out there. There are definitely resources for donors, and we'll hear about that shortly as well. And so we try and make it as easy as possible for those folks who do decide they want to proceed with donation. Next slide, please. So, you know, we've heard that it can take a long time to find a donor, and it's really important to just get support for yourself while that process is underway. It can be really hard to accept that people close to you aren't stepping up and offering for whatever personal reasons that they may have in their lives about what's going on. Sometimes people, you know, the donors that I've seen, sometimes they step forward and then their life situation or circumstances change and the timing's not right for them to donate. And then they come back several years later and say, now the timing is right. And so I've seen that happen quite often. So there's lots of different reasons why somebody may or may not move ahead. You know, really reach out for support as often as you need to from your home team social worker and from the transplant social worker if you need that as well. And just keep, either for yourself or whoever your donor champion may be, it's great to just provide updates. If it's been a few months, if you're still looking and, you know, if you're in a situation where you do have some time, it's just great to provide updates every few months if there is nobody that you're aware of who's moving forward. Next slide, please. So, whoops, that's a different order that I have than in mind, but that's okay. We'll go with this. So the donor social worker role is to meet with donors to assess to make sure that donation is right for them and that they have all the support they need to get through that process of the recovery afterwards as well. So when it turns out that donation is right for them, then we talk about what the practical tasks are, what things need to be organized ahead of time. Donors have to be able to plan for, usually I recommend usually 2 months off work so that they've got enough time to have a full recovery before resuming their work, and making sure that they've got somebody available to support them. Some people have animals at home. We have a number of donors who have big dogs who pull on leashes, and got to make sure somebody's available to walk them while they're recovering. And then also to make sure that they're aware of what resources are available to support them. Next slide, please. So from the donor side of things, I actually wanted to go back before finishing up on the donor side, because I realized there was something I forgot to mention on the kidney recipient side of things under the resources. So there are kidney suites available for people from out of town who need to come and stay in Vancouver for a kidney transplant. So you can talk to your transplant social worker or your home team social worker about that option. And when you come for the assessment process, the social worker will review that with you. So that's the main resource that is available for recipients. And it is someplace that people can stay for most of the time that they're down here, provided they're available. There are 7 kidney suites that are shared between the 3 hospitals that do transplants. So obviously St. Paul's is one of them, VGH is the other one, and then BC Children's also does transplants, and we share those suites. So that is a resource that is available. So sorry, now I'll go back to the donor side of things. So we're going to actually get to hear directly from a donor in just a moment. But many donors comment about how when they have made the decision to do this, that it was a very automatic decision for them. A lot of people say it was a no-brainer. They said, well, of course, I'll do it if I can. Most donors are really uncomfortable with people calling them a hero or saying that what a fantastic thing you're doing. Most of them just don't want any fuss about that. And it just felt like something that they would do and didn't think twice about. Donors talk often about how rewarding an experience it was for them. And of course, the statistics are excellent about donors leading healthy, normal lives with 1 kidney. We've got a number of former donors who are athletes, who have done, different campaigns to raise awareness, doing some athletic thing or another. So it definitely has been a positive impact for the donors who have gone ahead and done that. So I think next up we have Kelly. So is that right? No, not yet. Sorry. One more sec, Kelly. My apologies, everybody. So after donation, my role as the social worker is also to provide support through the recovery process. So a lot of our donors are very active folks who can sometimes find it hard to rest as much as they need to and get through that process of recovering. So I'm often reminding them as I'm checking in. And of course, our donor nurses are available if there's any concerns. And, I provide long-term support for all the donors who've donated. So if they happen to need any counseling support or need support in any other way, that's part of what I do as well. Next slide, please. So we do have a number of reimbursement programs for donors. The Kidney Foundation has the LODERP program, which stands for the Living Organ Donor Expense Reimbursement Program. And it actually assists donors with most out-of-pocket expenses. The only time the expenses aren't going to necessarily be fully covered is if somebody is coming from very far away overseas, because there is a maximum amount for flights that can get reimbursed. But the cost of travel to Vancouver, the cost of staying in a hotel for the donor, as well as the donor escort, so the person who's going to come to take care of them while they're recovering, that can all get reimbursed. So that's a great program. And there's also a donor mentorship program, and this consists of a group of former donors who are very happy to share their experience and talk with somebody who's considering donating. And in that case, if somebody is interested in being matched with somebody of a similar background, they can do that when they ask for the Donor Mentor. And that is, both of those programs come through the Kidney Foundation. Next slide, please. All right, the moment we've been waiting for. Now we get to hear from Kelly. So thanks so much, Kelly, for being here, and we look forward to hearing about your experience.
You're most welcome. Thank you for the introduction, Jody. Hi, everybody. I am joining you today from Abbotsford. I'm living and working on the unceded territory of the Stolo peoples. I'm grateful to be here. So thank you for listening to me in advance. So I am going to tell you a little bit about my journey as a living kidney donor. So I donated in 2019, June 18th, and I donated to a friend. Now, we both moved here to Canada from the UK 2007. So I did not know her beforehand, but both our partners work for the same company, so that's how we met. So I'll try and do it in order here. So my decision process. So my recipient did share about her journey on social media, and the platform mostly was Facebook. So we were getting to see what her journey was like. And ultimately, I'll skip, this is her story, not mine to tell. So I'll skip to the part where she was on dialysis. And she did the big ask on Facebook for a living kidney donor. Just during one of her updates of how she was getting along. So during that update, when I saw that ask in there, it was is worded very well, and no doubt help from the transplant team. But at no point did I ever see that message and think anything negative when I saw it. It was, I didn't feel pressured from reading it and being one of her friends on there or anything like that at all. As Frank said before, you know, it is up to the person that is donating, and at no point did I feel obligated. So I had started to consider it, and I'd been giving it a lot of thought and started to do a little bit of research, and I learned that somebody had come forward and was going through the application process. So then my research kind of halted there, and I just watched, you know, how they were getting along. And then something happened where the recipient could no longer continue. And I saw the resulting disappointment with that. It's heartbreaking to see and read. So at that point, I picked up my research pretty quickly. And actually, there was a moment there where I was standing in my hallway, and I was reading that post, and just this feeling came over me that I absolutely, and Jody alluded to this earlier, I knew that it would be me. If I chose to put my application form in, I knew that everything would work out. And it was like a really deep knowing feeling, almost like Jody said, like a calling. It just felt really, really right in that moment. And so I knew what I had to do. And I spoke with my family. I have 3 daughters. So I spoke with my husband and my 3 daughters about this and said, this is what I want to do. So we had discussions, and then the family supported my decision. So I popped my application in. and I applied November 2018, and I got approval to donate around March 2019. So I looked up these dates for you beforehand, and yeah, it seems pretty quick actually when I look at those. Between the tests, it was kind of, even though I had that deep knowing, they were long periods to me, like they may have been short in reality, but they felt long. So I chose to go through the process and not inform my recipient during the application and testing period. And my reason for this was that I didn't want to have, just in case, I didn't want to have that disappointment, to have her feel that again. So I had a lot of research, a lot of really good resources and support, amazing support were provided to me. I had additional support in the form of Living Kidney Donors support group on Facebook with thousands of members. And this was a really good continual kind of check-in for support, and really helped too. I read a book. It's called The Kidney Donor's Journey. And in this, something in there really resonated with me, that the author says. The author is Ari Seitner, and it's 100 questions I asked before donating my kidney. So between the information I was provided and the research that I did, I had a lot of information. I made a well-informed decision. So in here, the author says he likened it to standing in a lifeboat, or a boat rather, wearing a life jacket and seeing somebody drowning in the water in front of you, and having the choice, do I throw my life jacket to save this person that I can see, this situation that I can see happening in front of me? And the answer was absolutely yes, of course. But it was like I felt I'm standing here in a boat. I can throw this life jacket, I'm still in a boat, you know, and my family are beside me with all with the life jackets on. So if the boat starts going down, I just grab hold of one of those. A little bit of humor for you there. So yeah, it went pretty smoothly, as I expected it to be, with that knowing that I had early on. And I donated the 18th of June 2019. There was a little pause just after I was approved, while there's a couple of things checked with my recipient's health, and all went well. The transplant took place in St. Paul's. The staff are absolutely amazing, and it took place on a Tuesday, and I was home on the Friday. So yeah, like I say, went really well. The first question I asked, I remember when I came round, was, how is she? And I was told that she was doing good, and later told that she had her output, I'll call it, not to be vulgar, but her output was enough for 5 adults right after transplant, which was a pretty amazing thing to hear. I felt like I was in safe hands. I've shared before, one of there's a couple of things that really stood out to me. And there was a humorous moment too. So I was saying goodbye to my husband, about to be wheeled into surgery, and there was a very heartfelt, "Don't worry, we'll take good care of her." And then my bed crashed a little bit into somebody else's, but just a little bump, nothing big. But it was just a very funny moment, because it broke kind of like that tension that was in the room there, emotional tension. But yeah, that was a funny moment. And then I was wheeled into the corridor to the surgery. I'd seen my recipient on the way in, waved at her. I told her the evening before, "Don't stand me up." And as I turned the corner, the surgeon had previously said to me, "We're going to wheel you down at," was it 7:45 a.m., I want to say. But it stuck in my head. So I come around the corner and there were clocks on the top of the ceiling, and it was exactly 7:45. So at that moment, I was very, very nervous. And then it was kind of like that just gave me this peace and reassurance that I needed in that moment, that, boy, they really know what they're doing, you know. Yeah, and then I have a moment where I can remember being asked to open my mouth, and things like that. It just that stood out to me as being like so well planned, and there's such great care in there. Yeah, so that was my story in the hospital. Afterwards, I took around, I want to say 6 to 7 weeks, I think, off. My donation, the time for donation and recovery was covered by my employer. They actually were very supportive, so that really helped. Yeah, and I went back to work about a week early, and both myself now and my recipient are doing well as you can, hiding away during this pandemic, of course, keeping yourself safe. But that's my story. So thank you for listening.
Thanks so much, Kelly, for sharing. Those stretchers are very hard to drive, you know, in defense of the person who bumped them into each other. One quick question for you, Kelly, before you go off. Do you mind, sorry, losing my voice. Do you mind repeating the name of that book that you read that you found very helpful?
Sure. It is The Kidney Donor's Journey. 100 questions I asked before donating my kidney. I'm going to try and hold it up to my camera as well. Ari Sytner. So it's ARISYTNER. Oop, don't know. Oh, there we go.
Perfect.
Okay.
Okay, so there's a few questions that have come in. Yeah, we'll stick with the donor ones. There's a few for the recipients I'll go back to, but we'll start with donors for now. So there's a couple of related questions about, is there some kind of ideal age range for somebody donating a kidney? There was the mention about pregnancy, but just in general, outside of that, is there a specific range that people be like donors of a certain age?
So as I mentioned before, a donor has to be at least 19 years old, and then there's no upper limit for age. We just base it on your general health. So no, there's no preferred age, I guess I would say. We just depended on your own situation.
Yeah, and one of the specific questions is often around that upper end, and people find that a bit counterintuitive. But the way to kind of think about that, when we're taking a kidney from somebody, we're kind of thinking, what does the rest of their life look like? And for that reason, actually, if somebody's made it later in life and has no health problems, they're actually a great donor. So we sometimes, hear people in their 70s think, there's no way, I'm probably too old. But actually, if you've made it there in good health, you're a great fit to donate your kidney.
And we've actually had a number of donors in their 70s. We have a lot of donors in their 60s and 70s, and they do just as well as everybody else.
Yeah, exactly. Okay, this one's a good question. It hasn't come up before. Because there was the question about pregnancy, first with the recipient, how that can be a sensitizing event. And so one of the questions said, if a donor had a child, does that impact their ability to donate afterwards?
So after having a child, we do recommend waiting at least 1 year or until you're finished breastfeeding before you resume your workup. Now, for all living kidney donors, you need to do annual updates of your testing so that we can ensure that there's been no significant changes to your health. So if you've had a healthy pregnancy and you've had a child and you've waited 1 year and redo your testing and it still shows that you're healthy, then you can still go on to donate a kidney. But we just always reassess your status every year to make sure that it would still be safe for you to proceed.
Yeah, perfect, Erin. And then probably, I think the question may have also been specifically around the antibody issue, just in case that was the question. So that's really a recipient thing. That's not a concern from the donor side of things. So it's not like when we talk about sensitizing events, that's a recipient thing. That's not the case for a donor.
The only thing I would add about pregnancy for a donor is that just obviously makes planning for recovering a little bit more complicated to make sure there's really good childcare in place. So that's one of the questions as a donor social worker I would ask, to make sure that somebody else is there to be able to handle whatever the toddler may need.
Yeah. Good point, because even though, we heard from the stories and from the group here that you're home within a couple of days, you're not going to be back to picking up your 2-year-old, within 3 or 4 days. Yeah. Okay, so let me go through. Okay, so there's a question just about, when somebody, because you talked about the process of somebody contacting to be worked up as a donor. How long does it take to get back to that person on average? How long can they expect that process to take to play out?
So on first contact, it's pretty quick. I noticed you said that your donor reached out to BC Transplant. What I would say is your donor has to reach out to whichever transplant program you're completing your workup with. So that might either be St. Paul's or VGH. If you've been referred to St. Paul's, your donors can reach out to us here at St. Paul's as well, and we'll begin workup. We usually respond within a business day or two. We try to be pretty quick, but obviously there's factors sometimes that delay. So I think I had mentioned earlier, we always ask people to stay in contact with us to really relay that they're still interested in proceeding, and we try to move things along as quickly as we can. There is contact information on BC Transplant for both St. Paul's and VGH donor programs as well.
Perfect. Thanks, Erin. And the practical tip I always tell my patients is if for whatever reason you haven't heard back in a while, there's no harm in just picking up the phone and calling back. Things happen like anywhere else, right? So if they haven't heard in a while, just pick up and call again. Okay, so this is a good question. So there's a question here saying, say I'm being worked up as a donor and I get approved, and then somewhere along the way, I change my mind and I don't want to donate anymore. Is that something that would the recipient find out about that, or how is that handled?
Yeah, another great question. So as Jody had mentioned earlier, and I may have touched on as well, we do keep separate teams between the donor and the recipient. So on the donor side, we don't confirm that anybody's come forward as a donor, where you're at in the process, or anything like that. A recipient only gets notified once you've been approved and you're actually looking to set a surgery date. So up until that point, we don't see anything at all. Of course, your welcome to share as much as or as little information as you would like. But we always keep that piece confidential just so that there is no pressure that you might be feeling on yourself and no coercion there.
Perfect.
Yeah, and I often will have a conversation with somebody if they are not certain, right? Sometimes donors haven't made the final decision even when they've come through the final testing. And so we tell them to take the time they need until they're ready, and their privacy is completely protected with our team during that time.
Perfect. Okay, so this is kind of a almost the opposite situation, because Kelly gave her story. And I don't need Kelly, you don't necessarily need to go through the mechanics of this, but the question was, how did the person find out? And the question being, I think, to rephrase this, if someone is donating anonymously, does the person ultimately find out, or how does this process, how is that handled?
Are you asking if somebody is an anonymous donor, if the recipient finds out who they are? Is that your
Kind of
question?
what the question's going to be, is trying to get at here. Yeah.
Yeah, so again, to protect the anonymity of the donor, if it were a paired exchange, for example, the identity of the donor and the recipient stays private on both sides to protect everybody's privacy. So that information would not get disclosed in a paired exchange scenario. And occasionally we do have a scenario like Kelly, you were mentioning, you didn't want the recipient to be disappointed if it didn't work out for you. And we've even had some donors say, I want to donate, but I don't want the recipient to know that it's me. So in that case, we would basically just not disclose that information to the recipient. It's rare that it happens that way when it's direct, but it has happened. Sorry, I don't know, Aaron, if you wanted to add anything to that.
Yeah, go ahead. And then Kelly, I saw you were going to say you're in the individual situation, but Aaron, if you wanted to add, then I might say something too.
Sure. Yeah, I think that was great, Jody. You're correct. In the paired exchange program, it always stays anonymous. Very rarely does somebody donate directly to someone anonymously if that were to come up. I believe the recipient usually has to give permission basically to accept a kidney anonymously from someone.
Yes, and so too is the privacy. That's a choice, right? So that's something that's very, very clear. Kelly, you can share how it played out for you, but yeah, it's always,
Thank you.
we do whatever we can to protect privacy, and then it's up to the person doing it if they want to share. But Kelly, do you mind?
No, not at all. So in this situation, because she was a friend, I had the choice to let her know. So the one that fell through obviously had told her from the very beginning that she was applying. So I chose not to do that. But I did actually request to tell her myself, and I stayed in contact with the team at St. Paul's to let them know what I'd like to do. And so I actually went in, she was during a dialysis session, and I went into the hospital and sat with her, and I told her then she was hooked up to the heart monitor and everything, right? So that that helped in case it went too high. So yeah, we had a little bit of a giggle about that, and she had a little bit of concerns because I'm a mum, and I reassured her, you know, this was something that I wanted to do, and that they were all behind my decision as well. This, you know, this has been discussed. So did find it a little bit hard, like I say, but I did let her know myself, and then we had a couple of get-togethers beforehand. Yeah, and that's how it played out.
And you'll hear stories, the whole gamut, you know, where people say months in advance. I had a patient whose donor was the same thing. They knew each other but didn't want to say, and it wasn't until literally they were being admitted to hospital that they said something, you know, so it's really a personal decision. Great. Okay, so oh, there's a question about, you know, there's things about a question, is there counselors involved in the process of donating? Well, as Jody said, that's a big part of what she just did. I mean, we want to just reiterate that it's not like you have to come in knowing 100% that you're proceeding down a pathway. This is a big part of what happens. There's one last question just about what we call crossing blood types. That's kind of a very technical thing. It's I won't get too much into it, just to say it's something that is starting to happen a little bit, but in general, the answer is the closer of a match somebody is, the better off the kidney is going to be. But you may have seen something in media and stuff like that about what we call crossing blood types. So it is technically possible, but the team's generally always looking for the best match. And then the last question, this is back to the beginning for the recipient part. So when you mentioned about staying in Vancouver or also the kidney suites around the time somebody receives a kidney. One question was just how close do they need to actually be to the hospital? Are we talking that you have to be right down the street? Or is it within driving distance? So either if people are booking a place to stay or staying with friends or what have you.
That's another great question. So they certainly don't have to be right in the downtown core at all. It can be, sort of Vancouver area, Burnaby New West. When you start getting a little bit further out into the Fraser Valley, it can be really tricky if you don't have somebody to drive you in for the twice weekly follow-up appointments. So part of the challenge is the transportation options are pretty limited to be able to get people in if they're living in Surrey or Maple Ridge or Abbotsford or even Port Coquitlam. It can be difficult without a ride. And sometimes it's something that sort of stops the whole process until we can figure out a plan for that. So hopefully that was clear enough. You don't have to be right in the downtown core at all. Anywhere in the Vancouver area is great.
Yeah, perfect. Okay, so so that's actually all the questions we had in the box. We'll see if any last ones come up, but otherwise we have just a few other little pieces of information here. Alexis, if you go to the next slide. So we mainly wanted to post some of these resources. So there's a whole bunch of great resources out there. We've mentioned some of these as we've gone through, but there's some more here to have. There's our BC Renal website, the Kidney Foundation website, the BC Transplant, which I think will be on the next screen. And then also the one that's at the top is what's called the Kidney Foundation Peer Support Program or Kidney Connect program, which is great where they can put people who, for any aspect actually of kidney health, whether you're talking about dialysis or specifically here transplant, put you in touch with a peer who's gone through that. So a great support program there. And these other ones have these resources. I think the next slide is a couple more. Right, perfect. There we go, including the BC Transplant. There was the question earlier about contact numbers for each of the sites. That's definitely on there on both. We'll just flash those up. Otherwise, just as a reminder, this is kind of our pitch for upcoming webinars for those of you who are frequent returners. Our next one is going to be in next month about home hemodialysis. And again, if you click on that subscribe button, you'll get an update every time this happens. Otherwise, our last little thought that I want to leave people with is we definitely want to get your feedback. So you'll get after this a link for an evaluation form, which really helps us improve these sessions going forward. So please do that. Otherwise, I just want to close by thanking all of you for attending. We had about 40 people in attendance here, which is great. That's a good turnout. I want to thank everybody for the questions you were getting in. There were some really great questions there. And otherwise, I want to thank all of our presenters here who did just such a fantastic job. So we had our whole team from St. Paul's, which are just, you guys are expert. You've done this a few times now. You're getting your practice professionals at this. So great presentation. And especially want to thank both Frank and Kelly for sharing their very, very personal stories with us. That's always just such a valuable part of this. So I really, really thank you guys for sharing in such a personal way. I want to also thank Sharon and Alexis and Janet who have helped to arrange and do all the IT support for this. Thanks, everyone.
And thank you, Mike. Thank you very much, especially with your voice interruption.
If you could hear me, yeah, hopefully you could actually hear me. But no, thanks, guys. Bang up job to all the presenters, and thanks everyone for attending, and we hope to see you again at the next one.